We have done so far up to the AV node, and the next in the line is Qrs Complex. But before we discuss Qrs Complex, there are few important topics related to the Qrs Complex. The ECG leads, the bundle branch block, number 3, the axis deviation, and number 4, ventricular hypertrophy. So beginning with the ECG leads, which chest leads are on the right side of the chest? The chest lead 1, lead V1, is the only chest lead that is on the right side of the chest. And where is it? It's in the fourth intercostal space to the right of his sternum. Which leads are the fifth intercostal space? Leads 4, 5 and lead 6, chest lead 4, 5 and 6 are in the fifth intercostal space. Where is chest lead 2? The chest lead 2 is in the fourth intercostal space to the left of the sternum. So there are two leads in the fourth intercostal space, chest lead 1 and chest lead 2, but chest lead 1 on the right side of the sternum and the chest lead 2 on the left side of the sternum. Which lead is in the mid axillary line? It is the chest lead 6, which is in the mid axillary line in a fifth intercostal space. Which lead is in the anterior axillary line? It is the chest lead 5 that is in the anterior axillary line. And where is chest lead 4? I told you left fifth intercostal space and in the mid clavicular line. So chest lead 4 in a mid clavicular line. So what's the shape of Qrs complex and different chest leads? Beginning from the anterior leads, the right leads, if you see the configuration, the S wave is deepest in the chest lead 2, and in which lead the R is the tallest. The R is tallest in chest lead 5. So if you go from left to right here in this picture, from anterior to the lateral side, the S lead is deepest in the lead 2 and then it go on decreasing, whereas R wave, it goes on increasing towards the lateral lead and is tallest in the chest lead 5. And what is a transition zone? A transition zone is where in the chest lead, the S lead, you see, is bigger or deeper in the right-sided lead V2 and V3, but in the chest lead 4, the R wave is greater than the S wave. So this is the transition zone from chest lead 3 to 4, where the R wave becomes greater than the S wave. Septal leads, which are the septal leads? The two chest leads, V1 and V2, are the septal leads. V3 and V4 are the anterior leads, and the chest lead 5 and chest lead 6 are the lateral leads. So which leads are the bipolar leads? The long leads 1, 2 and long lead 3 are the bipolar leads, and rest of the other leads are unipolar leads. A bipolar lead records the electrical difference between the two limbs. And what does a unipolar lead do? They measure the voltage. There are 9 unipolar leads, including these limb leads, AVR, AVL, and AVS, AVF, and 6 chest leads. And which leads are the inferior leads? The lead 2, 3 and AVF are the inferior leads. So 2 of the inferior leads are bipolar, long lead 2 and 3, and lead AVF is inferior. Which leads are lateral leads? The lateral leads, as you see 5, 6 in the chest leads, and two lead, long lead 1 which is a bipolar lead and AVL which is a unipolar lead are the lateral leads. The two septal leads are chest lead 1 and 2. AVR does not give electrical activity of the specific side of the ventricles. The AVR looks at the cavities of the ventricles. Why the P wave, the atrial depolarization, the QRS, the ventricular depolarization, and the T wave, the ventricular repolarization, why all of them are negative in AVR? They are negative because the wave of excitation moves away from the electrodes. That is why all these P wave, the QRS, and the T wave are negative in AVR. What's the configuration of ECG in different leads? If you see that the AVR is much different along with chest lead 1 and 2 compared to the other leads. The R is upright in all these leads and T is also upright. T goes with R. If the R is upright, T will be upright. But in AVR we have a small R and a deep S and the T is inverted. And also in AVL the T is a little inverted or flat. And these two leads, chest lead 1 and 2 is small r with a deep S. But here the T wave is not inverted. T wave is upright here. So this is the AVR, lead AVR, which may have three configurations. It may have a RS, a QS, or a QR complex. The T is inverted always normally in AVR. Which chest leads do not have a Q wave? The right-sided chest leads V1 and V2 do not have a Q waves. Why? There is a small r in chest lead V1 and V2 and a big deep S in these leads. Because the ventricular depolarization first moves across the mid portion of the septum and then the wave of excitation moves down the septum into the left ventricles away from the electrodes. That is why there is an initial upward deflection and then there is a deep S wave. Which wave have Q waves? There is a small Q wave may be present in chest lead 4, 5 and 6. And the R wave is positive or tall in these leads because the wave of excitation moves towards the electrodes. What's a positive deflection? A positive deflection when a depolarization moving towards an active electrode, it produces a positive deflection. So here is the three inferior leads, long lead 2, 3 and AVF. So what are the lateral leads? Are the long lead 1 AVL and chest lead V5 and V6. And inferior leads are the 2, 3 and AVF. And they reflect the diaphragmatic surface of the heart. And the septal leads is chest lead 1 and 2. And the anterior leads are chest lead 3 and 4. So the axis deviation. What's the normal QRS axis? The normal QRS axis is from minus 30 to plus 100. And if it's less than, and what's right axis deviation and what's the left axis deviation? If it's less than minus 30, then it's a left axis deviation. And if it's more than 100, then it's a right axis deviation. See here, it goes less than minus 30, say for minus 45, it would be left axis deviation, and more than 100 would be a right axis deviation. So what leads you see in right axis deviation and the left axis deviation? The two leads that are seen are long lead 1 and lead AVF. Lead AVF. Long lead 1 and lead AVF. The R is positive in both of these leads, long lead 1 and AVF. But in left axis deviation, the AVF becomes negative, and in right axis deviation, the long lead 1 becomes negative. So long lead 1 is a lateral lead. The other lateral leads are AVL and the chest leads 5 and 6. The AVF is an inferior lead, and the other inferior leads are 2 and long lead 2 and long lead 3. So here it is again. This is a normal axis where lead 1 and AVF both are positive. In case of right axis deviation, this lead 1 becomes negative here and AVF is R is positive. And in left axis deviation, the lead 1 is R is positive, and whereas in AVF is negative. And both of them are negative when there is extreme of right axis deviation or a left axis deviation. See here, this arrow indicates that it's deviation to minus 45 degrees. So it's a left axis deviation, and the AVF becomes negative, the R becomes negative in left axis deviation. So what are the causes of the left axis deviation? So the left axis deviation may be present in normal athletes and young individuals. The other causes of left axis deviation are left anterior fascicular block, inferior MI, left bundle branch block, left atrial abnormalities, smoking, and obesity. So what are the causes of right axis deviation? They may occur in children normally, and also occur in right ventricular hypertrophy and left posterior fascicular block, lateral myocardial infarction, dextrocardia, and left pneumothorax. So if you see here that inferior MI causes left axis deviation, whereas lateral MI causes right axis deviation. The left anterior fascicular block causes left axis deviation, and left posterior fascicular block causes right axis deviation.